Hi, Nirmala. I'm so glad you're with us today. We're going to wait.
Good afternoon.
Thank you. We're going to wait just a couple of minutes to let people join us. There's been a lot of buzz about this presentation, so we're pretty excited to have you.
Well, I'm very excited to be here, and I am just surprised at the interest in this topic.
Yeah. We've been, we talk about safety. Once we had that conversation about safety, it really clicked for me, and so I'm anxious to share this topic with our community ed audience. So, you know what? How about I go ahead and get that poll launched now as well?
Yeah.
Okay. So here we go. So I've launched a poll here, and then I'll wait about one more minute, and then I will start introductions. I'm so ready for the weekend. It's cooler weather here in Central Oregon.
Here too, it is cloudy, and where I live and work from home, Clackamas County is under a air quality advisory because of the fires. So it's been kind of smoky and dull since yesterday, last 2 days. So
yeah,
the sun has kind of disappeared behind all that smoke. So
it is such an odd feeling when that happens. It's very uncomfortable. Okay, so I'm going to go ahead and start some introductions here.
Okay. Will you close the poll so we can see how people have answered?
Absolutely. Let's see.
So it'll give me an idea. Wow, look at that. So we have a lot of volunteers from Partners in Care. We have quite a sizable group of professionals.
Mm-hmm.
I am so happy that we have family members represented, and obviously my favorite group of people, caregivers.
Yes.
So, thank you all. Thank you all for coming today, and thank you for
Yes.
participating in the poll. I'm going to hand it back to you, Joelle.
Thank you. So welcome to this month's presentation from the Partners in Care Education Series. Today, we will be discussing a concept called elder justice with a specialist in the field of aging. So just a reminder, this presentation is 1.5 hours long to account for the amount of content related to this topic. And you will also receive the slides on Monday along with that follow-up email that I send out. And I will send Nirmala's contact information as well. So I am Joelle Blanchard. I'm your host today. I am the Community Relations Coordinator for Partners in Care. And I'd like to introduce Nirmala, our speaker today. Nirmala Dhar is a licensed clinical social worker with a master's in social work from the Brown School of Social Work, Washington University, St. Louis, Missouri, and Bombay University in India. She is mission-driven with 35 years of experience in behavioral health in the public sector in Missouri, New Jersey, and Oregon. She is the Older Adult Behavioral Health Initiative Project Director for Oregon Health Authority's Health Systems Division. There is a lot more to your bio, but I want to skip here. Her areas of professional interest include improving behavioral health access in long-term care settings, positive aging and age pride, social justice, quality improvement, health metrics, and workforce development. Wow. Thank you, Nirmala. We are so happy that you're here. So audience members, you're all muted and you do not have video capability. If you have a comment or question, please use the Q&A feature and I will check those at the end of the program. And thank you, Nirmala. Let's go ahead and get started.
Okay, if you want to put my slide deck on, and thank you for that invitation. And you heard her say what are my areas of interest. Joelle, could it be in the slideshow format? Is it?
Yes. Do you? Yes. Do you?
It's kind of, on my screen, it looks a little bit wonky, like at the
Oh, it does.
side. It's not covering my entire screen, but that is okay if,
Let's
yeah,
see.
if that's an issue, it's still visible. I don't know about the audience, what they are seeing.
Is that better?
No, it's the same, but
Oh,
it's okay.
okay.
It's still not, in the center covering the whole screen. If you want to just ask one of your audience member what they're seeing, because I just want to be sure they are seeing something.
Yes. Can we have some feedback? Were people seeing that okay? Let's see here.
Can anyone from the audience tell us?
Let's see. It says, her image fills my screen. I see it in the center. I can see the entire slide. Looks good.
Okay, so only
Thank
on
you, everyone.
Yeah, it's only on my end. That's okay. Okay, so what I was started to tell you was that Joelle mentioned all the areas that of work of interest I have, and she talked about social justice, and this really falls under that area, which is elder abuse, a call for action. And I'm absolutely delighted to be here. Next slide. I want to begin with a reflection. And I would like you all to just reflect on what I'm about to say, which was actually said by one of the people I most admire, Mahatma Gandhi. A nation's greatness is measured by how it treats its weakest members. Again, a nation's greatness is measured by how it treats its weakest members, our most vulnerable, whether it's older adults, frail older adults, people with serious mental illness, people with mental illness who are houseless and homeless, people with significant disabilities. How do we treat them as a nation? Really reflects, or it's the litmus test of our greatness. And I would ask you to personalize it to your own lives and to the organizations where you work or you are a volunteer at. Next slide. So my learning objectives are very simple. I'm going to talk about, prevalence of elder abuse and look at our data in Oregon. What is elder abuse? What are the types of elder abuse? Why is dementia a risk factor? And what are some interventions we all can do to prevent this? Because we are all here to really look at elder justice, that it's a human right for older adults to feel safe and secure wherever they live. Next slide. So let's just start with the definition. What is elder abuse? So it is acts of omission or commission. That means either you don't do it or you do it. So acts of omission or commission by a person who stands in a trust relationship that results in harm or threatened harm to the health and well-being of the older adult. So it is things you do or don't do that result in harm or threatened harm. And who is a caregiver? Any person who has the care, custody, or control of, or stands in a position of trust with an older adult or a dependent adult. So it's not professional caregivers. It's not that you have to wear a name tag which says you're a caregiver. It is any person who provides care, custody, or control, or stands in a position of trust for an older adult or anyone who's dependent. Next slide. And look at this sad, sad statistic. 5 million individuals each year, older adults, are abused in some form or the other. 5 million. That is 1 in 10 over the age of 65. Remember what was the saying by Mahatma Gandhi? Does this reflect our greatness? And by the way, this number is most probably underreported. That means it's probably higher, But this is what this big study that was done did was 5 million or 1 in 10. Now apply that to Central Oregon. Look at what your data is on older adults, 60 plus from census data. And then you can say every 10th person in that group will be at risk for abuse. Next slide, some really other very quick facts. Elder abuse, neglect, and exploitation, I just mentioned, are significant and unrecognized public health and human rights issue. Again, this is a human rights issue when we talk about elder justice. The research has demonstrated that elder abuse can have significant and far-reaching consequences on the health, well-being, and independence of older adults. And like I said, it is most probably underreported when I say, 5 million or 1 in 10. It's probably higher. Next slide. So why should we be concerned, all of us? Guess what? America is growing older. And so is Oregon, by the way. You can see this trend line here in red. What it shows is the older adult population will continue to increase till 2050. By the way, every day since 2011, that is 12 years ago it started, 10,000 Americans turn 65 every day. That is the baby boomer generation that was born after World War II. That means 1946 to 1964. And this generation will continue to turn older till 2030. We also have another very significant demographic watershed moment coming very soon in 2035, when for the first time in the United States, older adults will surpass younger people under the age of 18. That means we'll have fewer children born in the United States and we'll have more older adults. And that is actually only 12 years away or 12 or 13 years away. So really significant changes. And it's happening under our noses. And look at this population aged, next slide, 85 years old. It's growing as one of the fastest growing of the older adults is 85 plus. And do you know United States has the most centenarians, which is 100 people who are 100 years old. And why am I saying all of this? Giving you all this data, not to bore you, but to warn you that aging is a risk factor for abuse. Just getting older is a risk factor for abuse. And then getting older with dementia compounds that risk. Next slide. So you all today, all of you who answered our poll question today, you are on the front line. You're a frontline defender against elder abuse and upholding elder justice. Look at it. Abused seniors are 3 times more likely to die than non-abused seniors. Cognitive decline, sometimes called dementia, is a risk factor for abuse, including financial abuse. Do you know that's one of the first signs of Alzheimer's disease is that your loved one or your client is not able to manage everyday finances? So they're at high risk for financial abuse. Look at it, abused seniors are more likely to be placed in nursing homes than non-abused seniors. And we all know, I already told you that it is underreported. And really the thing is that only 1 in every 23 cases gets reported to Adult Protective Services. So when I gave you that prevalence, it's probably not correct. It's actually much more because only 1 in 3 actually gets reported. Next slide. And then there is ageism. I want to put it front and center, right and front. Ageism refers to how we think, feel, and act towards ourselves and others based on our age. Now, you are very well aware that our American culture does not celebrate aging. In fact, we do the opposite. We actually try to erase it, or we always associate it with debility, debility and dependency. We don't look at older adults as as people who are active citizens, who can contribute to our society, who have years of accumulated experience and wisdom like many other cultures do. Ageist ideas are ingrained in us and are systemic. And they influence decisions we make at the individual level, at the community level, and at the government, policy, and societal level. How we think of aging. And aging is one of those last isms which is still alive and kicking. Next slide. Did you know that ageism affects longevity of older adults? There's a wonderful book that has just been published. It is called Breaking the Code by Becca Levy. She's a researcher at Yale, and all her work is around ageism. She talks about people who experience ageism actually die 7 years earlier. Absolutely. So really, I really want to challenge you to take a moment to think about your own ageist attitudes, biases, and stereotypes. And how are you going to change that going forward? One very simple way is to speak up when you hear people doing that. That's not okay. That is ageism. And then really looking at how do I change that in my organization, in my family, or in my community. Next slide. And then there was COVID-19 and the pandemic, which in some degrees continues. The COVID-19 had a particularly devastating impact on older adults. And guess what happened during those long periods of lockdown and social isolation? Elder abuse actually went up. The prevalence, the incidence, that means more people were at risk. Absolutely, for all kinds of risks, but very much more for financial abuse. Next slide. So here it is again, I want to emphasize the definition. So elder abuse includes physical, sexual, psychological, verbal abuse, as well as neglect, abandonment, financial exploitation of an older person by another person or entity. And it can occur in any setting. We sometimes have this kind of myth or misconception that it only happens in licensed foster homes or licensed nursing homes. Absolutely not. It can happen in the elder's own home, in the community, in their own apartment, in their own home. So it can occur in any setting. And very sadly, it occurs in a relationship where there is an expectation of trust, or when the person is targeted specifically due to their age or their disability, or a combination of both. And then guess what? Very sadly, multiple forms of abuse may occur at the same time. In fact, all the research shows that as an older adult gets dementia, so does the number of kinds of abuse also increases. So as their dementia worsens, so does the abuse, and the different kinds of abuses also increase. Again, I want you to keep at the back of your mind that saying of wisdom from Mahatma Gandhi. Apply that to everything I'm saying. How do we treat our most vulnerable people? That is a a commentary on our culture and our society. Next slide. I'm not going to go over this, but I just pointed out again, it is underreported, and it is very much under-identified in emergency rooms, emergency departments, where sometimes older adults are taken, in an emergency situation. So they're underreported and not even detected. Next slide. So here are some risk factors for the victim or the older adults themselves. And we're going to look at all of these later. One is functional dependence or disability. They are associated with greater risk for abuse. Poor physical health. Cognitive impairment, more often dementia. Poor mental health, especially having, depression. Low income. So, the older adults who have lower incomes are at higher risk, sadly, for abuse. Now next slide. Now look at the perpetrators. Many of them have psychological health problems like depression and anxiety and substance abuse. The perpetrators of these, and I call it crime, whether it's an alcohol use problem or a meth problem, or they have mental health issues, very much in the picture for the perpetrators. Next slide. So my focus is really on the victims. And if I speak about the perpetrators, it's really in the context of how they abuse. So older victims experience shame, pain, economic loss, spiritual and physical anguish, early institutionalization, that means they're sent to a nursing home, and poor quality of life because of this abuse. Now you can see why it is an elder justice issue, correct? Because we are all entitled by the Constitution to be happy, correct? Studies suggest that older adults exposed to physical and verbal abuse have higher mortality risk. That means they have higher risk of dying than those who did not experience any of this kind of violence. So these are very real results or outcomes. Next slide. So I want to talk a little bit about elder abuse in racial and ethnic minority groups. In African American older adults, there are, in 2018, there were close to 4.5 million African American elders aged 65 years and older. So just some highlights. I'm not going to go through everyone. African American elders are subjected to abuse and oppression. They may endure it because they want to preserve family ties, and they want to avoid going to nursing homes. They fear institutionalization. And then lifelong systemic oppression and discrimination create ongoing power balances, which reinforces some of this risk. Okay, that exposure to racism, segregation across the lifespan absolutely impacts the health and well-being of older African American elders. Next slide. But guess what? African American elders have some unique, what we call protective factors, which we want to encourage, not just in African American community. I wish we could encourage in all our communities across the board. They have a greater sense of community because they have a prominent tradition of embracing community networks, including extended family and kinship groups, neighbors, church, service organizations. They have very strong religious affiliations, which is a very important source of strength, and a protective buffer. Very loyal to family and family unity, which has been a long-standing source of resilience across generations. for African Americans. They have a culture which respects older adults, where they are revered within the African American community and admired for their wisdom, strength, and dignity. And then African American cultures values mothers, and they're recognized as protectors of the family. So these are all actually protective factors. Next slide. So the research finding, I'm not going to go over all of this, but really within African Americans, along with physical abuse, verbal abuse was very common. Older adults, they reported less psychological abuse. So just some differences that I wanted to point out. Next slide. In the Latino population, in 2010, it made up close to 7% of the US population. However, it is much higher in Oregon. Oregon, this is the second largest group after Caucasian white in Oregon. It is close to 18% of our population in Oregon is Latino. So older adults who are Latino, in the general population, 55% were immigrant and 41% had limited English proficiency. And 1 in 5 lived below the federal poverty line. What are the barriers to reporting elder abuse? Often they reside with families and rely on them for care. Familialism is emphasized, that is the family over everything else. Undocumented Latinos are less likely to report abuse for fear of deportation of themselves or their family members. There's also a greater general mistrust of the government. Then there is limited English proficiency, so that may be a barrier to reporting. And then there are some cultural beliefs too, which I have given my citation that you can explore further. Next slide. Very quickly about Asian Pacific Islanders. This is a very broad term, and it encompasses 20 different ethnic, racial groups with different languages. In Asian Americans, yes, culture can also be a source of protection and a risk factor. In many cultures, Asian cultures, the family group is emphasized over the individual, and this can affect the elder's willingness to admit abuse. Then choose culturally appropriate words. They may not relate to the term abuse. That may be very unfamiliar, but and unacceptable. But words such as sacrifice, suffering is more acceptable. And Asian elders may not openly display strong emotions or feelings. And emotional problems may not be something they talk about. So it's very important to kind of understand the culture when you are going to be working with these racial and minority groups, especially if you are in adult protective services. Next slide. Now look at the emergency room. Elder mistreatment or elder abuse was more often than not missed in the emergency room. In a major study in 2017, they looked at a sample and look at it. Only 0.01% of older adults presenting in the US ERs were formally received a diagnosis of elder mistreatment or elder abuse. Imagine. And I told you what the prevalence was. Further, they generally ask this one question during triage, which is vague and kind of ambiguous. Are you safe at home? And that question has proved very inadequate in really finding out information about elder abuse. Then look at primary care settings. That's where we all go, next slide, to see our family doctor or our family nurse practitioner. despite multiple encounters, that older adults have with their family doctors, and mandatory reporting statutes. Look at it, healthcare providers made only 11% of abuse reports, with physicians accounting for 1%. I don't know if there are any physicians on this training, but physicians reported only 1%. A study of healthcare workers found physicians identified 5 major barriers of why they failed to report. Just their professional orientation, their assessment, that's not part of their assessment, their interpretation, systems which are barriers, and then very big was knowledge in education. So I'm glad that the Partners in Care is putting on this training today. And if there are no primary care staff here or physicians here, please take this information back to them. Next slide. So again, I'm going to be peppering this definition over and over again so that it sticks with all of you. Elder abuse refers to intentional or neglectful acts. Remember, I talked about commission and omission. That's what this is: intentional or neglectful acts by a caregiver or trusted individual that leads to harm for an older adult. And look at elder abuse who experienced even modest amounts of abuse, had a 300% higher risk of death when compared to people who were not abused. Think about that for a moment. Many of you work in hospice and palliative care. How many of you during your intake actually give information on elder abuse to your older adult patients and to the families? Is that a policy you have? Is that an expectation of every staff that you talk about elder abuse as part of the orientation or intake that you do with patients that you admit into your programs? Well, if you don't, this is a very good starting point. Next slide, please. So elder abuse and neglect shortens lives. I've already told you 300% higher risk. Even when we control for everything else, so what happens is a single episode of victimization can tip over the person. In other words, because older victims have fewer support systems and reserves, physical and cognitive reserve, and economic, the impact of abuse and neglect is magnified exponentially. And a single incident or even minor episodes of mistreatment is likely to trigger a downward spiral, leading to loss of independence, serious complicating illnesses, and even death. So think about this model of tipping over. When you are an older adult and you have now limited reserves, physical reserves, mental reserves, economic reserves, that anything can absolutely tip you over. Next slide. And so here are the effects of decreased reserve that I was talking about. You have greater susceptibility to illness just because of aging bodies. You have more difficulty recovering from an illness. You have sensitivity to side effects of medications. And there is vulnerability to abuse. And abuse can do all of the three things above. It can exacerbate all of that. Next slide. So here are what are those age-related changes that make older adults vulnerable? They have difficulty defending themselves. They're more likely to get injured. You and I may be able to shove off someone who is trying to attack us physically or sexually. An older adult just may not have the physical reserve to do that, or the mental reserve to understand what's happening. They may require more care because they are both cognitively and physically compromised. Next slide. And then age-related changes can mask or mimic signs of abuse, such as bruises, fractures, sores. Because, skin become thin, their skin tears are more easily, you bruise more easily. How do we distinguish whether this is happening just because of aging or that someone is causing the bruises or the fractures? They fell and broke their leg because, they are osteoporotic, or is it someone shoved them, or, that's why they fell and they broke their leg? All really, this all confounds this. Next slide. Again, more information. I just said aging and disease factors make it very difficult to identify this. No, this is abuse. Older adults have multiple medical diagnoses at the same time. And then we have this kind of ageist bias. Remember, I talked about ageism, that death and disability is expected. So you don't even look for abuse, that is someone pushing them along faster. And in our culture, many older adults are invisible. That means we hide them away, we segregate them, we lock them up. Sometimes there's no social support and no one kind of looking out for them. And in our culture and in Oregon, unless dementia is recognized, as adults are assumed to be able to protect themselves. So what happens in all those cases where dementia is not recognized? We don't have the workforce to recognize and give you a diagnosis. We just assume that they have full capacity to take care of themselves. But guess what? No, that is not the case. But our law says that we have to assume they have the ability to protect themselves. I don't know how many times I consult on that, where there are very limited resources for us to really work with those people who don't have an official diagnosis but are at risk. Next slide. Look at the percentage of substantiated allegations in 2020 in Oregon. Look at that. Verbal abuse seems to stand out up there at 24%, physical abuse at 29%, followed by financial. These were all the kinds of abuse. And when we say substantiated, that means they were verified and found to be true. Take a moment and think back to what I said about the saying by Mahatma Gandhi, that a nation's greatness is measured by how we treat our most vulnerable. Look at these high rates of allegations. Substantiation of elder abuse in Oregon. Next slide. So, what are some tactics used by abusers? Physical abuse, they hit, choke, burn, pinch, throw things, restrain the person. I know this seems shocking, but it's all true. Sexual abuse, sexually harmed during caregiving, forces sex acts, forces elders to watch pornography, or even voyeuristic ad where you are watching the older adult. One very sad commentary that disabled adults, especially people with developmental and intellectual, 80% of disabled adults across their lifespan, women, are sexually abused. 80%. Isn't that shocking? Look at psychological abuse. engages in crazy making behavior, publicly humiliates them, kind of tricks them into believing that they are, there's something wrong with them psychologically. Emotional abuse, like yells, insults, calls names, degrades, blames, threatens. Targets the vulnerabilities, like denies access to items, refuses transportation, denies food, medications, refuses to dress or undress the person appropriately, denies access to spiritual and traditional events. Next slide. Ridicules personal and cultural values, uses family members against them, isolates the older adults. For example, denies access to the phone or mail. By the way, that is by law. It's a violation of Oregon administrative rules in license setting. You cannot deny use of telephone. Manipulates use of privileges, exploits them financially, threatens them. I will put you in a nursing home. I will kill your dog. Actually brandishes weapons. And I'm not making this up. This happens. Next slide. So physical abuse is any physical force that results in bodily injury, physical pain, or any kind of impairment. And we already went over this: hitting, slapping, pushing, shaking, kicking, inappropriate use of drugs, that means medications or other drugs, physical restraints, such as putting them in a chair and putting a belt around them, force feeding, strangulation, and suffocation. Sexual, we've already said, non-consensual sexual contact of any kind, any form of unwanted sexual contact. Includes contact with person legally unable to give consent. Rape, sexual battery, oral copulation, sodomy, unwanted touching, sexually explicit photography, voyeurism, and digital violation. All is considered sexual abuse. Next slide. Look at that. 1,515 allegations. Now, this is not substantiation. That means that many reports were made of physical abuse in 2020. Next slide. Remember, inflicted bruises are large, size matters. Be suspicious of bruises which are over 5 centimeters. Absolutely be suspicious. And abused elders are more likely to have bruises on their head, neck, right arm. So pay attention to where the location is. And guess what? People who are abused are more likely to remember how they got bruised. So ask them. Don't just assume they're older, they have dementia. I won't ask them. Next slide. Medications play a role. They can be overused. Guess for what? To sedate them. And this can cause delirium. Or they can be underused. So that, hey, it'll reduce mobility. That will, it's too much of a hassle to take this person out for a walk. So I'm going to underuse the medication. Or it can cause illness exacerbations, like if you're not giving the right amount of insulin or inhalers for their asthma, or antibiotics for a infection. And these are all true. This happens. And then misused, so that you as a caregiver are misusing it for unapproved conditions. So absolutely, medications can be used as for abuse. Next slide. Psychological abuse, infliction of anguish, pain, distress through verbal and non-verbal acts. It is a pattern to undermine the victim's confidence and to create fear. psychological fear, psychologically an unsafe environment, and can take many forms, such as isolation. I mean, you are isolating the older adults. Threats and intimidation. If you don't do what I say, I'm going to lock you up in your room. If you don't do this, I'm not going to let your daughter visit you. Insensitivity and disrespect. Shaming, blaming, withdrawing affection. I will stop loving you if you report me. I will disown you as my mother. Can you see the fear that you're creating in someone who's already vulnerable and actually dependent on you for their care? Financial, illegal or improper use of someone's funds, property, or assets. This could be theft of cash, valuables like jewelry, cars, boats. Let me tell you, I've seen it all. Transfer of deeds, withdrawal from bank accounts, misuse of credit cards, changing wills and title documents of properties. Next slide. Look at this. In 2020, 4,000 allegations of financial abuse. 4,000. I'm not saying they were all substantiated, but imagine there were 4,000 that actually came to the attention. Can you imagine how many more are there which never got reported? But there were 4,000 allegations. Next slide. Abandonment. Any kind of desertion of an older adult by an individual who has assumed responsibility for providing care. For example, leaving a person who's unable to provide information at a hospital. And let me tell you, it has happened. They just abandon them at the hospital waiting room or a mall. Can you imagine how terrifying that is? Neglect, refusal or failure to fulfill any part of the person's obligation or duty towards that older adult. That is neglect, whether it is medical neglect, physical neglect, failure of fiduciary responsibility, that is financial. All of that encompasses neglect. Next slide. There were a little over 1,600 allegations of neglect in Oregon in 2020. And yes, 15% of those were substantiated. Next slide. Then there is involuntary seclusion. Confinement, isolation, restriction to his or her room or a specific area. You will not leave your bedroom. Or placing restrictions on an adult's ability to associate, interact, or communicate. I'm going to take away the phone. When your daughter calls, they tell, no, she's sleeping, you can't talk to her. What are the warning signs? An adult reports of not being able to see or talk with people, kept away from family members or friends, not allowed to use the phone, not allowed to use mail. By the way, these are all violations of law. Next slide. There were 276 involuntary seclusions. Can you believe it in the 21st century? That's how we are treating our elders. Next slide. And then there's wrongful restraint, using physical or chemical restraints. And by chemical restraints, we mean medications, where you're using that to restrain a person. Or when a licensed health professional has not conducted a thorough assessment prior to implementing a physician's prescription for restraint. And where less restrictive alternatives have not been tried, evaluated, or documented. And where the restraint is used for convenience and discipline. I can't tell you the horror stories that I've seen, where sometimes we're in nursing homes where everyone is sedated, sitting in their chairs and their heads are, bobbing. it's convenient, right, to have quiet, sedated people. Warning signs of physical or chemical restraints: being overly sedated, going to bed at an unusually early time. Like, how is bedtime 4 p.m.? I have lots of facilities, like foster homes. Oh, their bedtime is 4 p.m. No, no, no. We believe in person-centered care. You need to figure out what is a natural bedtime for that person. Or they have bruises or marks on wrists, or which will show like they were restrained, like strip-like marks. Or adult reports being tied up or sedated and not allowed to move. Next slide. And we all are aware of financial scams. They come in many, many shapes and forms. Medicare scams, funeral cemetery scams, fraudulent anti-aging scams, telemarketing, reverse mortgage, sweepstake, grandparent scams. I mean, I can spend a whole session on that. Next slide. These are all the other kinds of financial abuse, which are, did you know power of attorney abuse? Isn't that sad? Undue influence. We are going to go over some of these. Next slide. Risk factors for financial abuse. A high percentage of seniors live alone, and they tend to be more vulnerable to scams. Many older adults can be trusting and ready to believe sale pitches. Salesmen who make pitches, for your roof needs to be replaced, or your gutters need to be replaced. So absolutely being aware. How many seniors live alone in your community in Central Oregon? Should we be on the lookout that they are not being scammed? Next slide. So what's the difference between financial abuse versus fraud? At the crux of abuse and fraud are the identity of the perpetrator. Elder financial abuse is committed by people in positions of trust, like your daughter or your person with power of attorney. Fraud, the perpetrator is a predatory stranger, like a salesman or a telemarketer on the phone. That's the difference. Next slide. Power of attorney is abused. They use their power maliciously, causing an older adult to lose their home, assets, and property. Red flags for power of attorney abuse: the agent is vague or evasive about financial arrangement. Purchases made by them are not on the older adult's behalf. Their decisions do not seem to be in the older adult's best interest. And what would be red flags for the older adults? The senior or the residence appears unkempt and dirty, and care doesn't seem to be there. The older adult is forced to sell the property, and the older adult is placed in a facility well below their ability to pay. And currently, I'm working with a case right now where the adult son and daughter-in-law moved into a gentleman's home who still owns the home. He has, very advanced dementia. They threw him out of the home and brought a restraining order against him. It's his home. So we are working through the case right now. Next slide. And then there's the concept of undue influence. When a person uses their role and power, such as an adult daughter who is power of attorney, or a grandson who's come into your life, or a paid caregiver who exploits this trust and dependency, and they use their power to gain control over the decision-making of that older person. These tactics are used in cults for brainwashing and are widely used by perpetrators in domestic violence, this concept of undue influence. And now guess what? The law actually recognizes it. Next slide. So undue influence is nothing but persuasion, pressure, or influence short of actual force that so overpowers the will of the older adults or whoever else the vulnerable group is, that he or she cannot act in their own best interest voluntarily, that this person takes over their brain, like brainwashes them and starts making decisions for them, even though they may not have any kind of legal authority. Next slide. So how can you recognize undue influence in your community? Making checks, missing checks or property, missing unusual activity in the bank, eviction notice or utilities are not getting paid, placing the individual in living situations where that was not necessary, a caregiver who shows unusual interest in their older adults' financial matters. So all of these should be like red flags to all of you. We are all called to uphold elder justice. Next slide. So there are lots of similarities with this concept of undue influence, and it's very similar to domestic violence. The victim and the abuser have an ongoing relationship that allows the abuse to occur, like in elder abuse and in domestic violence. The abuser may be charming and charm the victim to gain control. And the abuser isolates the victim and creates this psychological dependency on them. Or they provide inadequate nutrition, withhold medication, deprive victim of sleep, or make those psychological threats. I had a case of a domestic violence victim where the perpetrator would threaten to kill her beloved dog if she filed a complaint. So it's very similar. Okay, next slide. So what can you do? Be on the lookout of who's entering the lives of seniors who live alone. How much time is this person spending with this older adults? Is this like a recent friend who has just showed up? Are there signs that this friend has mental health or substance use problems? And does the older adult have the mental capacity and ability to say no or make decisions? Or is this person taking advantage of it? Next slide. So, many of you have heard about the cycle of abuse. This also pertains to elder abuse. And I have put this here for you to take a look at later. It is, if you can see all the types of abuse and how it is manifested in older adults. Okay. For example, psychological abuse. They use privileges. You won't get this privilege. You won't be able to see your daughter. You won't be able to call. You won't be able to go to church. That is a form of psychological abuse or threats. So I will let you take a look at this as you will be getting this slide deck. Next slide. We already went over the targets, the tactics that abusers use. For example, they target the vulnerabilities of the older adults, and they can deny access to supports vital for their daily living. For example, breaking or hiding glasses, eyeglasses, hiding the dentures or hearing aids, moving a walker or wheelchair out of reach, refusing to translate material into English, from English to the native language. These are all tactics where they are targeting vulnerabilities. Can you imagine not having your eyeglasses when you can't see? Isolation. We've already talked about that. Keeping them isolated from family and friends, minimizing, so that it minimizes the opportunities that the older adults can tell someone, hey, I'm being threatened, or I've been being abused. Keeping them away from the phone, refusing to let them go to church or other community activities. And you know why? This forced isolation is more easily accomplished with older adults, because they already have a smaller social circle due to lack of mobility and transportation options. And many of their family and friends have either passed away, or they're just not there in their community. So how important it becomes for all of us as frontline defenders of elder justice to really check on older adults who are alone, who don't have family members. Next slide. Manipulation is another tactic. And here it is psychological or emotional. This may be accomplished by name calling, playing mental tricks, for example, hiding items, so that the older adults will start doubting their memory. They may scare the victims into thinking that you will place them in a nursing home. Those are all manipulations. Okay, next slide. And here I'm giving you some examples. I'm not going to go over every one of them. A victim may have injuries that do not match the explanation of how they got those injuries. What will the abuser do? They will minimize or deny the victim's injuries or complaints. They may attempt to convince others that the victim is incompetent or crazy. Or they have repeated accidental injuries. They'll blame them as being clumsy. Oh, they just keep walking into furniture all the time. They appear to be isolated. Physically assault or threaten violence against the victim's families, friends, pets. That's what the abuser does. Look at be difficult or hard to get along with. The perpetrator will refuse to allow an interview with the victim alone without being present, so that they can monitor what's being said. Next slide. The victim may be emotionally and financially dependent on the abuser. So is the abuser. And that's why they're keeping the relationship. They may delay seeking medical help. Why? Because the abuser will cover up that the abuse is being taken. Or they may go from doctor to doctor to doctor, so nobody would actually know, what's happening. So all kinds of tactics. Next slide. So what are the unique dynamics of late life abuse? They're generally older, the victims. Perpetrators can be of any age. Gender, sadly, majority are women, especially in cases of physical and sexual abuse. They have an ongoing relationship with the perpetrators. And in power of control, they are kind of, they experience a pattern of tactics to gain and maintain compliance, such as threats, intimidation, isolation. Those are the tactics which are used in late life abuse. Next slide. How is it different with men and women? Abuse hurts both men and women. However, they face different risks. Older women are more likely than older men to have experienced a history of emotional, physical, or sexual abuse. Current cohort of older women have fewer financial resources than older men. They also tend to live longer than men. And so if they lose their income and assets, it profoundly impacts them. On average, women tend to be physically smaller than men, and they may have physically less ability to defend themselves against physical and sexual assault. Older women are more likely to be widowed and divorced and living alone. which puts them at risk for abuse. Older women are more likely to be living in residential settings and care facilities. Older men are less likely to have a network to help support and protect them, a social network. Older men may be dependent on their spouse for cooking, cleaning, and all of that, and it may make it harder for them to leave a abusive relationship. Older men have a more regular source of income and pension, and therefore puts them at greater risk of fraud. Okay, so that's kind of some of the gender differences. So next slide. So why is dementia a risk factor? What is dementia? It is a brain disease. It is progressive. It is irreversible. Once you have it, it's not going to go away. It just actually gets worse. Currently, no cure. And it is in the top 10 leading causes of death in the United States. Next slide. Dementia is an umbrella term, and it covers many different kinds of dementias, out of which Alzheimer's disease is one kind of dementia. There are 70,000 Oregonians currently living with dementia. Majority of them do not live in institutions. They live in their own home or in the community. Next slide. This is what dementia affects: learning, memory, language, attention, judgment, reasoning. Look at all of that. Decision-making, planning, mental flexibility, organizing, self-regulation. These are all the different parts of the brain that get affected, which results in functional impact in the everyday life of older adults. Next slide, please. So why is dementia a risk factor? Why are people who have dementia vulnerable? They have memory impairment. They have communication difficulties. They have judgment problems. And sadly, as dementia progresses, so does risk for all types of abuse. So impaired language or motor abilities, language abilities to communicate abuse to a third party. You don't have that ability. Lack of decisional capacity to address the abusive situation. Coincident depression of the abused older adults complicates the diagnosis and management of elder abuse. Next slide. Research indicates that people with dementia are at greater risk of elder abuse than those without dementia. We know almost 6 million Americans have dementia in the United States. Close to half of all people over age 85 have Alzheimer's disease or some other kind of dementia. One study revealed that close to 50% of people with dementia experience some kind of abuse, whether it's verbal, financial, of some kind. So very high risk. Next slide. So this means that people with dementia may be unable to report. They may not be believed, and may not be believed by us as caring professionals or caregivers or family members. And they may be unable to recognize what's happening to them as abuse. So what are the risk factors for dementia and elder abuse? Low social support, not enough friends and family there to check in and check that everything's going okay. Functional impairment like loss of mobility, need for ADL care, or they're laying in need to have 24-hour assistance. Poor physical health. If you're a woman, lower income, living in a household with large number of members who come and go, And if you have a diagnosis of dementia, obviously, more advanced, higher the risk. Next slide. Victims are frail, physically and cognitively impaired, dependent on others for their care. They are frequently isolated, whether it is because of their frailty or because it's intentional. And they're unable to report. First of all, they're isolated, and then they don't have the cognitive abilities to report. What can you do? Listen. Do not discount someone telling you something because they have a dementia. Look for elder abuse if there is any kind of behavior change, and ask the questions. Even if you don't suspect abuse, ask the question. Next slide. Here are some potential indicators. Dehydration, malnourishment, bad oral health and decayed teeth, overgrown. These are like extreme. You can't miss it. Matted hair, over-medicated, unexplained weight loss, soiled clothing, pressure ulcers which are not healing. Next slide. Emotional and behavioral signs, unusual changes in sleep. Fear or anxiety, every time you come, the person is crying or fearful and covering. Isolated and not responsive. Very depressed. And their body language communicates fear to you. Next slide. Indicators of the environment. The residence is poorly maintained or is unclean or unsafe. Heating and cooling is missing. There's no food. There's bad smell in the room. There are insects and vermin everywhere. You can't see where their assistive devices are, easily available for them. Next slide. Here is a list of additional indicators, and I'm not going to go over all of them, but repeated falls, that they keep falling and the caregiver is actually pushing them, but they want to pass it off as they're just falling. Or repeated hospitalization. Hey, why is this person coming to the ER every other day? Next slide. Physical abuse, skin tears, tears in sites other than arms and legs, multiple tears and abrasions due to rough caregiver handling. There are different kinds of fractures. Especially be wary of fractures in the wrist and in the back. Next slide. Bruising is a marker of elder abuse. Absolutely. If there are big bruises, 5 centimeters or more on the face, lateral right arm, on the torso, absolutely think about abuse and ask about it. Next slide. Other red flags, implausible or vague explanations by the caregiver, delay in seeking care, unexplained injuries. They can't tell you how they got it, either the victim or the caregiver. Inconsistent stories. They tell you one story today and then something else tomorrow. And you're observing a sudden change in the behavior of the victim. Remember, many of these victims cannot speak. They have lost that ability due to dementia. But emotionally, they are showing fear or change in the behavior. They're crying. Absolutely think about abuse. Look at the contextual issues. Why, what's happening. Next slide. Clues on physical exam. The doctor should check all of this. Why this location? Why delay in seeking? Here are some other, things to look at, at your doctor's office. Next slide. Sometimes the victims want the abuse to end, but they're afraid because they want to maintain the relationship. They love and care the abuser because it's a adult child. They don't want to be placed in a facility. So very often they want to end it, but don't want to put their family and their loved one at risk. Next slide. So consider asking these questions. Is someone hurting you? How are decisions made about your life? How often do you see your family and friends? Can you disagree with your caregiver? I'm not going to go over the whole list because of time. Next slide. There are more questions here that you can ask. You can ask directly. Things like, are you made to stay in your room? Do you feel the caregiver is keeping you from doing what you want to do? Are you afraid of anyone in this home? Next slide. And then absolutely follow up with a yes answer by validating, identifying it as abuse, affirming their right to safety, and then making those appropriate referrals. Next slide. I just want to very quickly talk about self-neglect. This is when the person exhibits one or more of this: persistent inattention to personal hygiene or environment, refusal for indicated services that can improve their life. So if it's yes to one or more of this, that means that is self-neglect. Okay, it essentially means the person is not obtaining necessarily food, clothing, and medical care for their health and safety. Next slide. There were 2,718 allegations of self-neglect in 2020. Unfortunately, we don't have a lot of time to go over self-neglect. So Joelle, I'm going to skip over these, go over to the next, one more slide. Who are the perpetrators? No, one back. Mostly adult children or spouses. More likely to be male. They often have a history of substance abuse and mental health issues. Okay? In long-term care settings, there were almost 8% of complaints involved abuse, gross neglect, or exploitation. Okay, next slide. We went over, I showed you this wheel earlier, but next slide. Because of time, I'm not going to have time to really go over it in details. However, I want to move to the next two slides, if you don't mind. People will get this, so they can look at it and contact me for information. One more, please. Yes. So the abuse, the wheel that I showed you, here are some, again, I'm reiterating some of the questions that you can ask based on that wheel. Has anyone tried to hurt you recently? Has anyone close to you called you names or put you down? Does anyone slap you, pull your hair, or touch you in a rough way? Does anyone threaten to do any of these things to you? So they don't do it, but they threaten. I will hit you, I'll beat you up. But they don't do it, but it's a threat. So this also is part of that wheel that you just saw. Next slide. We always want to advocate for what we call a victim-centered approach, where the person is in the center of anything and everything that you plan for. So I just wanted to point out that we want to work with a victim-centered approach. Next slide. Always consider things like mobility, function, health condition, environment, and caregiver capability and limitations. Absolutely, in your assessment. Next slide. Always screen for elder abuse. Educate victims on patterns of abuse. I would say educate older adults on patterns of abuse. Provide emergency contacts as part of your intake package. And develop policies in your agency. Okay, next slide. I showed you this earlier, the data APS completed 10,728 abuse investigations in 2020. Next slide. And look at the age of the victims, 2020. Can you see? They increased substantially between 65 and 85. Remember, I said age is a risk factor. And with dementia, it's even more. And as you can see, it actually increased as people grew older. Next slide. And this slide just gives you the substantiation rate. For example, from all the financial abuse reports, allegations, 21% were actually substantiated. Yes, abuse happened. So I'm going to let you take a look at it when you get this slide. We are all, many of us or all of us are mandatory reporters. Next slide. So the state law mandates that when you see abuse of any kind, not just elder abuse, any kind, that you are a mandatory reporter. And I have the phone number here for you to call if you see abuse. You can skip the next slide, tells you all the different professions. I want to talk about elder abuse. It's a reality in our society. It is increasing. It is under-recognized by people like us, and it can be effectively addressed in our communities. Next slide. We want to actually make this all communities aware of this World Elder Abuse Awareness Day, which happens on June 15th. Please mark it on your calendars for next year, that you do something to bring about awareness on this day. Next slide. Our goal should be to make elder abuse a cultural taboo, that elder abuse is a violation of human and civil rights, and that we should have zero tolerance for elder abuse. Next slide. A just society means recognizing that all people are equal, including older adults. No matter how old we are, justice requires that we are treated as full members of our communities. Our society currently does not keep people connected to their communities at all stages of their life. So therefore, it leaves them vulnerable to abuse. To correct this, we need to ensure that our communities are set up to reduce social isolation and help address elder abuse. So absolutely, elder abuse is all of our work. Next slide. What can you do to take a stand? Learn about elder abuse. Watch out for older adults in your life and in your community. Report abuse. Promote raising awareness about elder abuse in your churches, in your synagogues, in your senior centers, everywhere. Make it a community effort. Okay? And now what? I'm not going to go over it at this point, but if you can skip a few slides, please, I'll tell you when to stop. One more. Will you become a champion, a volunteer champion, to bust elder abuse? Next slide. And we want to empower your community, whether it's your church community, the community where you live, to place elder justice at the forefront of all your work. Next slide. And this is a real call to action. Will you prevent elder abuse? How will you promote a culture of zero tolerance wherever you work and wherever you live? How will you advance and protect human rights of vulnerable older adults so that we can meet that definition of greatness, that Mahatma Gandhi spoke about? So that is my call to action for all of you. Next slide. Stamp out elder abuse in your communities. And I thank you all for inviting me today. There's lots of resources. If you can go to the second to the last slide. One more, please. One more. Here. Together, we have the power to prevent elder abuse, whether it is in Bend, in Central Oregon, or in all of Oregon. We all need to work together to stop elder abuse. Next slide. Thank you. And here is my email address. Joelle, if you want to remove this and we can go back to a slideshow, gallery format. And I'm very happy to take any questions or comments. And people can either ask me directly or you can read them out.
Wow. Thank you, Nirmala.
Yeah.
I learned so much. Thank you so much. Parts were a little intense. So I can offer to support anyone who wants to talk through some of the things that Nirmala brought up today. Let's see. So the first question is, can part of the reason for the neglect that they cannot afford the kind of help that they need?
Absolutely. Again, that means we as a society need to give a priority for older adults who are aging and who have cognitive decline in terms of resources, right? Absolutely.
Right. Next question. We have just a few more. Any stats on how often an elder with dementia falsely accuses caregivers of abuse?
You know, it is very common. It is called, it's not so much falsely accusing, it's more like a delusion, which is part of their dementia, which is a neuropsychiatric symptom. But there could be older adults who don't have dementia who falsely accuse. And, that's why we have the process of substantiation. Yeah. So it's not automatically, hey, it's true. It goes through a process of verification by professionals.
I did notice that comparatively, the substantiation rates were really low. Can you speak to that?
So lots of reasons for it, but each allegation goes through what I'm hoping is a rigorous a substantiation process where they do an investigation. I'm not an APS specialist, but what happens is then not that they throw out all the rest. They're still concerned that someone brought up those concerns and they explore those.
Mm-hmm.
There may be other mitigating circumstances, for the set that did not get verified as abuse or neglect. But yes, those are the substantiation reports, the numbers that I gave you.
Wow. So another question is, how can we determine if someone on my street has self-neglect, if there's someone coming to the house to check on them? So how would we respond to some of these concerns that we might have?
Calling the hotline if you have any concerns about an elder in your community, like your neighbor. Actually knocking and checking on them, so that the caregiver or the perpetrators know, oh my gosh, they have a nosy neighbor coming in every now and then, so I better be careful.
Mm-hmm.
If you're in a facility, there's a person called the ombudsman that you can call and report to, and it can be done in confidence.
Okay.
So, absolutely. Or report it to professionals if you're just a caring neighbor and you are working with professionals in home health or something, reporting it to them and then let them do whatever the next step is.
So one question we have here is, how do we find out more information about what the role of the ombudsman is?
Do you know you can invite an ombudsman like you invited me to speak?
Okay.
Well, I can put you in touch with your ombudsmans in Central Oregon.
Well, that might be the next step then.
Yes.
Okay. Well,
you have a team of ombudsmen, and they all work in like different levels, like in assisted living, in nursing homes, and foster homes. So I'd be very happy to introduce you if you can send me an email later, and then you can be in touch with them.
Excellent.
Generally, the number it has to be posted in all licensed facilities.
I have seen that before. So I'm wondering if
Absolutely.
that's
But it may be good for you to know what is their role, who are the ombudsman team in your Central Oregon.
great. Thank you, Nirmala. Okay, well, I think I'll wrap up in the interest of respecting Nirmala's time today. Thank you so much. This has been so informative. Thank you for giving us your slides as well. I know that I'll be thinking about this all weekend. So the audience knows I will send you a follow-up email on Monday, including a survey link. Please give us some feedback. I'll include Nirmala's contact information and her slides that she's generously provided today. And feel free to reach out to me if you have any more questions, and we'll move forward and really tackle this this topic head on, I hope, with our agency. So I know you got me fired up again. We spoke, must have been months ago, maybe a
Months
year
ago,
ago, and
yeah.
I looked out for the June 15th Elder Abuse Awareness Day, and it was everywhere on social media. So I was really pleased to see that it is at the forefront.
Okay.
Great.
Well, thank you for inviting me again, and write to me and I can do the introduction to the ombudsman team.
Fabulous. Thank you, Nirmala. Have a
Care.
great
Stay well,
weekend.
everyone. Bye.
Bye.